Okay, sorry for that. My storage kind of was full and I didn't know I wasn't recording anymore. I actually finished, but it stopped halfway. So I'm going to go over the peripheral vascular system again. So for the cusp, we're going to observe the color ulceration, swelling, repeating edema and scars. We're just going to have a patient lie down and check for any of these, if there's any scars or any ulceration anywhere, which is not good. For temperature, we're going to use the back of our hand, just go over the patient's body, chest area, arms, legs. Just make sure that they're not running too hot or too cold. And for the to-go, we're going to pinch off the skin and check for the elasticity, which when you do that, the skin should bounce back. And the same thing with the texture, just make sure there's no bump or, bruises or any form of nodules, and then ask them if they feel any tenderness anywhere. And while we do this, we're going to go ahead and palpate for the feeling pulses. And video I already previously recorded for the pulses, all of them are going to be done bilaterally at the same time, except for the carotid artery, which supplies brain to pulse to our head. When we can do that at the same time, or we might pass out. So excuse me. So for a temporal, go ahead and palpate the pulse at the temporal lobe here. You should feel both of them at the same time. They should all be at the same time. That way you can compare and contrast the two of them. And then for the carotid, like I said, going to do one at a time. Go ahead and feel the carotid artery here, which mine is about 2+. I can feel it really, really well. And for the while you do for the right hand side, go ahead and do for the left as well, and compare both of them. Make sure that they are beating at the same time. They have the same count or time. And you can move over to the brachial, which I say brachial for thumb. Which I say brachial for pinky. So for the brachial, we're going to do the pinky, which is the elbow, and you're going to listen to 1 or 2 fingers. I usually use 2, very softly. I can feel mine. It's a 1+. And then while you're doing on the right hand side, go ahead and do on the left hand side. Make sure that they both beat at the same time. So after that, we're going to go to radial. Radial is thumb. We're going to go to a thumb and wrist, and here you're going to gently palpate, which I can feel mine very well. It's a 2+. And while you do it for the right hand side, you also do it at the same time for the left hand side. And then for the femoral, it's going to be at the groin here. Usually when I wear tight pants or panties, I can feel them very well. So palpate them 2 at the same time and make sure that they both have the same pulse. And then for the popliteal, this one is behind the knee, which by the time I did it for my patient, I wasn't able to feel anything. But you should be able to feel the pulse there, and do both knees at the same time. For the dorsalis pedis, is going to be your between the two, your big toe and the second toe. Go up a little bit where your foot arches up. You should be able to feel the pulse down here. And mine is 1+. And then for the posterior tibia, is going to be where your ankle bone is, your medial malleus. Just below it, there should be a pulse. It's difficult for me to find. I couldn't even find it on my patient the last time. And I'm not able to find it right now as well. So after that, you're also going to assess for patency of ulnar and radial artery, which here you have your patient raise their hand, you pinch off their ulnar and radial artery for 10 seconds, because when you do that, you're cutting off blood circulation, and pause. So you should be able to see their hand go completely white, and then you release the brachial or the ulnar part, and the color should return back to your hand. And when you release the ulnar part, the radial is supposed to be working, which when the color returns back to your hand, it means the radial part is working. So if anything should say happen to the ulnar part, the radial part should be able to still supply blood to that hand, or you would lose it. Now that is called Allen test, and when that happens, then we say yes, it is patent. That concludes for the access for capillary fill. We should be able to pinch off our fingers and for 3 seconds and wait for capillary fill. Our hand should, after it drains and turns white, it should be able to go back immediately and change to pink color. The blood should return to it immediately, like 2 to 3 seconds. Anything longer than that means the capillary fill is slower to action, which is not good, and it should be recorded as well immediately. So that's how we check for, and why we do it for our fingers as well. We also do that for our toes. And that concludes our peripheral vascular system. We're going to go over to the bedside neuro exam. And for the level of conscious, we are looking at alert. Someone, when you walk into the room, they become alert and their eyes are open spontaneously. That's fully alert. And then for the voice is when you have to kind of speak to them, verbal stimulation for them to respond to you. And of course, their eyes track your movement while you're moving around the room. And that is for response to verbal stimuli. And for the pain, it means for this response, you kind of have to elicit pain, which can be rubbing the chest or touching the earlobe, then they respond to you. So the last one is going to be unresponsive, which this ranges from 15 to 3, the score, and this response to stimuli is not going to be a 0, it's going to be a 3. And this means they're not responding to both alertness, voice, or pain. So the next one is going to be orientation. For this orientation, the person is able to orientate well in person, which is they know their name, their occupation, their age when you ask them. And then also, if you ask them where they are, they're able to tell you which place they are, maybe in a hospital, in a clinic, or in a friend's home, or their own home. And times they should be able to tell you, okay, today is Sunday, or maybe first week of the month. And also for motor response, you can kind of ask them to make a fist and see if they make a tight fist, or put out 2 of your fingers, not the whole, just 2. Ask them to hold it. If you're able to put your fingers out, then they have weak muscle response. But if you're not able to put your fingers out, then they have good muscle response. The same thing with the hand. You kind of go ahead and push, ask them to lift their legs, either like this, or raise their legs while you push them. If they're not able to, have like a force against your hand, then they have a weak muscle response. But if they're able to hold their knee while you're able to push against your arm while you're trying to push down and have some resistance, then that's good muscle response. And then for the Perla, we're going to assess the pupil, which we look at the pupil. It should be nice and good, the color is supposed to be not maybe grayish or a little bit a weird color. It should be equal in size and shape. One shouldn't be bigger than the other, which is abnormal and bad. And then it shouldn't be overly big or overly small. And also, using the pen light, you should be able to check the roundness and the symmetrical. They should be nice and shaped well and react to light, which if you shine a light, it's supposed to constrict. And then also use your finger to do a test. Move it away, have them follow their finger up and down and sideways, and also bring it close. It's supposed to constrict, and if you take it apart, it's supposed to, of course, dilate. And then the knee, you're going to use reflex hammer and maybe strike it on something, have it vibrate, place it on the foot, or strike it on the foot directly. Reflexively, they're supposed to, their leg is supposed to like have that jerky reaction, which is good. No reaction at all is not good. For the assessment of the abdomen, we need to observe the 4 quadrants. And before that, have a patient lie down and observe, just inspection with your eyes, what's going on, if they have any drainage, maybe from the navel, or maybe they have any abnormal pulsation while you're lying down and breathing normally. They shouldn't have any pulsation anywhere, which is bad. And also check for umbilicus caput medusa. It's not also a good sign. There is no belly button discharge or anything, and hernia. They shouldn't have any bulges anywhere on the stomach. And also this venous pattern, which you usually see on pregnant women, like a kind of vein webbed out from the belly button area. Of course, men shouldn't have that. And then we're going to auscultate for bowel sounds. We're going to start at right low quadrant, auscultate with the diaphragm here, like right low quadrant. You start from here, and then up, across, and then down. That is the path of the large intestine. Right lower, right upper, left lower. And you should be able to go ahead and listen to bowel sound. And we're going to listen. Normally you're supposed to listen to this for 5 minutes. That way you can hear sounds which could be termed hypoactive or bobiorgmy, if I say that correctly. So while after doing after auscultating in the 4 quadrants, you're also going to listen to brutes, which always we use the bell side of our stethoscope. And here I kind of have a shape made out in my my notes. So it's supposed to be aorta, if I'm correct. Yes, it's supposed to be aorta at the point here where your chest kind of stops, the bone, and your stomach starts. So aorta is going to be smack in the middle here. And then you're going to move over to aorta, renal, iliac, and femoral. So aorta here, and then on the other side, just a little bit down, supposed to be renal, and the same renal on the left is going to be the same on the right. So it's going to be aorta directly across here, and then a little bit lower. That's renal, and a little bit lower. So have aorta and say move over to one side or the other side, and then lower is going to be renal. And then for the iliac, it's going to be again lower under the renal and then left. Also aorta right across, a little bit lower renal, and lower again, and then a little bit left will be iliac. So aorta is just one, but renal is two, and then also iliac is two as well on both sides. And then for the femoral arteries, of course, you're going to femoral artery is going to check your groin area. So that concludes for the brute sound we are trying to listen to. And moving over to the percussion, we're going to percuss the abdomen for masses, excess air, and fluid in the quadrants, and we should be hearing tympanic sound or dullness. And for the four quadrants, of course, we're going to start at the right lower. You're going to percuss here, warm your finger here, and then strike it. Of course, when you strike higher, you're supposed to hear that. I heard it, like the dull sound, which is where you have your organs in. So you do the four quadrants: right lower, upper right, upper left, lower left. And then while you're doing this, of course, you're checking for masses or in the excess air you feel here. Okay, so you're going to go over and also percuss the abdomen for liver span. Which liver span? Right, and right hand side. You're supposed to, you can go ahead and check for the size. You can start from up, and as soon as you hear the dull sound, you stop. That's where the liver starts, and then you start from the lower again and percuss up until you hear that dull sound. That tells you that the liver size is between that place you stop from the upper and the place you stop at the lower. That's the liver span and size. And then for the spleen, it's going to be on the left hand side on the anterior axillary line, which you're not supposed to feel the spleen at all, on the left hand side. So that covers it for the spleen. And then while after the spleen, we're going to palpate the abdomen, and we're going to start with light palpation. Oh, sorry, that's my stomach. We're going to do a light palpation across the stomach, and you're going to do the four quadrants, which you start at the lower right, palpate at the upper right, the upper left, lower left. And then you're also going to do the deep palpation while checking for masses and any excess air. And then after that, you're going to go over and palpate for the liver, spleen, and kidney, which for the liver, you kind of hook your hand under your rib cage, right hand side. You should be able to feel, I feel something. I don't know if it's my liver, but it's painful, but I do feel something a little bit. That's how you palpate for your liver. For your spleen, you shouldn't be able to do that because the spleen is entirely covered. If you do feel anything on that left hand side, then it's not good. It should be reported. And for the kidney, you kind of, while you're having your patient lie down, while you're doing this, if I haven't mentioned it, patient should be lying down. You kind of want to have them lie down, put one of your hand under the edge, like at the stomach, put one hand under and one on top, kind of squish them together. That's how you palpate for your kidney. And also while you're doing this, you're going to be checking for tenderness as well, or soreness or pain. And then for the inguinal nodes, it's going to be, I don't think I have to auscultate again, so I can remove this. For the inguinal nodes, it's going to be horizontal and vertical. So you have palpate across like this and then across like this. So you're going to go ahead and do the circular palpation, feeling for nodes, tenderness, and soreness, and then you also go ahead and do it horizontally and then vertically. So the last one is going to be for percussing the CVA for tenderness, blunt percussion, which is across the back on your right hand side and also left where your kidney is supposed to be. Kind of place your hand and use your fist to percuss so that you can kind of hear the sound come out like loudly, because it's at the back as the posterior side. So that's how you percuss for the CVA. And you'll be checking, of course, for if there's a tenderness or pain there. As soon as you do that, your patient is going to let you know with a howl. So after that, the last one is going to be, of course, the bowel sound. While you're checking all this, you're listening to, especially when you do the palpation and the auscultation in the 4 quadrants, you're supposed to listen for 5 minutes. Wait until 5 minutes before you record for maybe no sound, because sometimes it takes long for you to hear bowel sound, which means that the stomach, the area is hypoactive. So of course you're listening for the hypoactiveness or the gummy sound. I hope I said it right. So that concludes for the final testing. Sorry that it's split into 2. I didn't know my phone memory would just fail me at the last time. So this is the second time I'm recording this in case I'm rushing. Thank you so much, and good luck in your new job. And my patient says hi too. Thank you. Bye.